Coronaviruses are a large family of viruses that are common in many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people, such as with MERS and SARS. Symptoms for confirmed 2019 nCoV infections. Reported illnesses have ranged from people being mildly sick to people being severely ill and dying. Symptoms can include fever, cough, shortness of breath. CDC believes at this time that symptoms of 2019 nCoV may appear in as few as 2 days or as long as 14 after exposure. This is based on what has been seen previously as the incubation period of MERS viruses. How 2019 nCoV spreads. When person-to-person spread has occurred with MERS and SARS, it is thought to have happened mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. Spread of SARS and MERS between people has generally occurred between close contacts. It's important to note that how easily a virus spreads person to person can vary. Some viruses are highly contagious, like measles, while other viruses are less so. It's important to know this in order to better understand the risk associated with this virus. While CDC considers this as a very serious public health threat based on current information, the immediate health risk from 2019 nCoV to the general American public is considered low at this time. There is much more to learn about the transmissibility, severity, and other features associated with 2019 nCoV, and investigations are ongoing. The latest situation summary updates are available on CDC's web page. 2019 novel coronavirus, Wuhan, China. Prevention. There is currently no vaccine to prevent 2019 nCoV infection. The best way to prevent infection is to avoid being exposed to this virus. However, as a reminder, CDC always recommends everyday preventive actions to help prevent the spread of respiratory viruses, including, wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. These are everyday habits that can help prevent the spread of several viruses. CDC does have specific guidance for travelers. Treatment. There is no specific antiviral treatment recommended for 2019 nCoV infection. People infected with 2019 nCoV should receive supportive care to help relieve symptoms. For severe cases, treatment should include care to support vital organ functions. People who think they may have been exposed to 2019 nCoV should contact your healthcare provider immediately. See interim guidance for healthcare professionals for information on patients under investigation. What to do if you are sick with 2019 novel coronavirus 2019 nCoV. Recently returned travelers from China. If you were in China in the last 14 days and feel sick with fever, cough, or difficulty breathing, you should seek medical care right away. Before you go to a doctor's office or emergency room, call ahead and tell them about your recent travel and your symptoms. Avoid contact with others. Not travel while sick. Cover your mouth and nose with a tissue or your sleeve, not your hands, when coughing or sneezing. Wash hands often with soap and water for at least 20 seconds to avoid spreading the virus to others. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. Steps to help prevent the spread of 2019 nCoV. If you are sick with 2019 nCoV, follow the steps below to help prevent 2019 nCoV from spreading to people in your home and community. Stay home except to get medical care. You should not leave your home, except to get medical care. Do not go to work, school, or public areas, and do not use public transportation or taxis. Separate yourself from other people in your home as much as possible. You should stay in a different room from other people in your home. Also, you should use a separate bathroom, if available.